Hello, and welcome to our brief Injury and Violence Prevention video lecture series with a focus in this short segment, Planning Public Health Interventions. I'm Carol Runyan, Professor Emerita at the University of North Carolina Gillings School of Global Public Health, and I'll be talking about the Haddon Matrix and third dimension. So this diagram may be familiar to you or something similar to it as a standard in practice of developing and implementing and evaluating interventions, where we start up here in the upper right, just remembering what our principles are of public health and defining the epidemiology of the problem to be addressed. And from there, we develop understanding of the problem and the population of interest, defining the nature and magnitude of the problem, identifying and engaging stakeholders from the population, and then getting their help in examining characteristics of the population and also accessing available data. From there, we work to identify potential targets of change and consider what evidence-based strategies exist to make that change. Once we do that, we develop a logic model, choose our strategies, set our goals and SMART objectives, and then develop an implementation plan. Now, those steps sometimes need to be repeated and circle back through some of the earlier ones before we get it all nailed down. But once we get through the steps in the green box, we move over to the left in developing our evaluation questions and a strategy for measuring both the process by which the intervention took place and what might need to be changed there, and the impact in the short term and the longer term outcomes of the intervention. And once we know what our questions are, we can choose our evaluation design, whether it's an experimental design, a quasi-experimental design, a before and after, and so on. Once we do that, we often want to pilot test and just make sure that we know how to carry out the intervention as planned and also to carry out the evaluation as planned. And that's referred to as formative evaluation, basically just a test of everything you've developed so far. And from there, we go on to implementation after the kinks are worked out, collect the evaluation data, and then move on to dissemination. In this talk, I'm only going to be talking about these two elements using the Haddon Matrix as part of this part of the process. So in applying our public health principles, we think about the characteristics of individuals, both their physical and behavioral characteristics, the products that they may come in contact with. For example, in the case of injury, we're talking about weapons, drugs, vehicles, toys, different things that might be modifiable, but that affect whether an injury can occur, as well as the physical environments, geographical features and physical structures in which injuries take place, as well as the social environment, which includes things like social norms in that particular culture and any policies in place or that are trying to be put in place. We have a number of intervention approaches we can use, and I like this list because it rhymes. We can educate, we can regulate, we can legislate, and usually as a last resort, we can litigate. We have to remember, particularly when we think about education, which is often what people think of first, that changing people is very hard. There are many factors that keep people from doing what they know they should do to be healthy or to be safe. And so one of our tasks in public health is to try and devise interventions and strategies where the safe choice is the easy choice, or where the healthy choice, if we're not talking about injuries, is the easy choice, so that we don't have to rely on people to make individual decisions, remember what the right thing is to do, and carry out behavior changes, some of which may not be that easy to do. But education is an important part of the overall process. It's rarely sufficient by itself, but it's usually a part of a larger strategy where we try to change environments, systems, products, so that we can move upstream, provide universal protection, and reduce disparities. But that education doesn't need to be just directed at the person who may experience a health problem, but often we use education as a way to talk to people who are in a position of decision making about changing the environments, changing the systems, inventing or creating, producing the products. So that takes us to William Haddon, who was a leader in injury control in the middle and late 20th century. He applied basic public health concepts for planning using the agent-host environment model that I'm sure you've heard about in other courses, and then using concepts similar to the primary, secondary, and tertiary prevention. He referred to these as pre-event, event, and post-event. They're not exactly the same, but they're very close. So he developed this matrix, which at the top, you see the word factors, and that refers to the columns, the host, the agent, the physical and social environments, things that can potentially be changed and be the targets of change. Whereas the rows refer to the time period in which those changes have their effect, whether it's the time of the event, whether it's before the event to keep the event from happening, or after the injury event to mitigate the longer term negative outcomes. So let's look at an example. So in the case of a motor vehicle crash, we might be talking about the host is obviously the person who's injured. In this case, we're talking about the car, that product, that vehicle, physical environments and social environments. And the event is the actual crash. And then things that keep the crash from happening and things that one might implement for use after the crash, having their effect after the crash to minimize the effects of the crash. So in that first row, let's look at some examples. We might teach in the first column of that first row, teach drivers traffic laws, discourage driving after drinking, discourage texting while driving. Those are things usually that would require education, but also laws. We could change things about the car as well, make sure the car is in good condition, has good tires and brakes, all the updated electronic equipment that helps reduce crashes. Then there's the issues around the environment. Are the roads well maintained? Do we need clearer signage, better lighting, and so on to prevent crashes from occurring? And then elements of the social environment might be the norms around using designated drivers when someone's been drinking, obeying speed limits, not texting while driving, and the policies as well as the norms that go with those. And you'll see there's some overlap between the host here and the social environment. In the crash row, we might talk about encouraging seatbelt use. And I know this is often confusing for people because, of course, seatbelts are installed in the car and you put your seatbelt on before you drive, before there's ever a crash. That's true, but seatbelts don't prevent the crash from happening. They prevent injury when the crash occurs. So that's why it belongs here in this second row. It has its effect at the time of the crash. Similarly, passive restraints like airbags are a modification of the car, but they have their effect at the time of the crash. They don't prevent a crash from happening. Then things about the physical environment, energy absorbing light and sign poles, open space at the edge of the road so that if one goes off the pavement, they don't immediately hit a tree, but they have some space for the car to come to a stop. The energy absorbing poles also make it so that if you do hit one of those poles, it's less devastating. And along with that, some of the policy interventions to getting support for enforcement of seatbelt and other safety laws. And then in the post-event phase, teaching first aid skills to everyone in the car, whether it's the person injured or whoever is injured, to take care of themselves or others around them. Reducing some of the hazards of the car itself, for example, the flammability if they're if the gas tank is involved, having emergency call boxes along highways, availability of quality emergency care. So these are just some examples that fit with that model. The matrix is really excellent for brainstorming options for interventions, but it doesn't guide you to the choice among the multiple options. And that's where the third dimension comes in. Oops. So the third dimension forces you to compare the different types of interventions that you might have come up with using the matrix by the values that you consider important in your particular environment in which you're working and the particular problem you're working on. Some of the key ones that we use have to do with effectiveness. Does it work? Is it fair? Is it equitable? Does it stigmatize? Because usually we don't want it to stigmatize. What about cost? How much does it cost to do the intervention? How much does it cost if you don't do the intervention? What sort of freedoms are involved, and are certain freedoms being infringed upon? And are those freedoms that are really important, or are they ones that people can live with the infringement? Is it acceptable to the community? Obviously, different communities have different norms, different cultural values. Will the interventions that you're coming up with be acceptable in the community? Now, obviously, to the extent you have local stakeholders involved, that will help figure this out. And then I always put feasibility last, because I think you don't want to rule something out just because you think, well, maybe people won't like it, until you've gone through those other steps. But there are two kinds of feasibility. One is it technologically feasible? Do we actually know how to do this? And secondly, is it politically feasible at this time in this setting? And then there may be other strategies that you want to think, or other values that you want to incorporate that are important in your particular setting and related to your particular problem. The advantages of the third dimension are that it forces clarity about what's important in the decision process as you go through that process, and encourages you to use data to figure that out. You can look at data on effectiveness in the literature, for example. You can look at data on cost. You can do surveys to find out about what freedoms are important or not, and what's acceptable, and getting at some of those others. It also facilitates participation in the decision-making process in a structured way that enables a variety of people as part of a group to participate, but all be sort of working on the same way. And it makes it easier to talk about the reasons for the choices that you've made once you've decided what intervention approaches you want to use. And that may enable you to more successfully advocate for the choices you've made. So I want you to remember the matrix and the third dimension were developed in the context of injury prevention, but they can be used for addressing any public health issue. And I encourage you to try it on multiple types of issues. I've had students in the past who have tried it on infectious disease, on chronic disease, and it works. Here's some additional references that might be helpful to you to learn a bit more. Plus, we have an hour-long lecture on this that goes into more depth that might be interesting for you to use. And here's where you can get more information. Thank you.